folks on with us, and of course people will join as they have time. Mandy, I see you just started the recording, so perfect. So I will call this meeting of the Assembly Public Safety Committee meeting to order. And today is November 5th. And I'm Crystal Kennedy. My co-chair, Cameron Perez-Verdia, will not be able to join us today. But Mandy, if you can start us off with the roll call, otherwise we'll see who else is here with us. Thanks.
Ms. Kennedy?
Here.
And then Mr. Perez-Verdia is absent. Mr. Peterson?
Present.
Mr. Constant? Mr. Dunbar? Ms. Zalatel?
Here.
Ms. Quinn Davidson? Oh, I apologize. She is not listed on this. Mr. Rivera? Mr. Weddleton? I do see Mr. Weddleton.
Yeah, I'm here. Sorry, I had it on mute.
Miss Allard?
Alive and well.
Miss LaFrance? All right, thank you, Chair.
All right. Thank you, Mandy. We have several people that are joining us. I can see a lot of names here, and I would just say that certainly we have the department chiefs, and I see Mr. Falsey. So anytime anybody needs to chime in, please just get my attention and then introduce yourself for the record. So we're going to start off with just kind of our routine updates. And looks like we have the police department up first. So Chief Dahl, you want to give us some updates, please?
Sorry, it took a second. That Microsoft moved the microphone button on me there, so I couldn't find it. I don't have anything major to report. We gave a big update last month with stats and other things, but otherwise, I think we're pretty good to go. So I'd be happy to pass it on to Fire. Unless there are questions, as always.
Great. Yeah, let's open it up to questions first. And I do want to mention that we are all kind of working on the car and body cameras. And, we have an ordinance from the administration in regard to that. So just want people to know that that is an ongoing conversation, as there is a tax levy involved with that now. So we'll be keeping people up to date with that as it develops a little bit more. But anyway, any questions? Let's check the queue here. I know for the record then, please, that Mr. Dunbar is with us. But any questions?
I just arrived as well. Constant here.
Okay, we have Mr. Constant with us too. So any questions for APD at this point? All right, then, hearing none.
Madam Chair?
Oh, yes, go ahead.
Before you move on, I don't have the buttons in front of me. I just wanted to congratulate APD and Anchorage in general. I just was chatting up with the chief, and I want to note that although the country has gone through all kinds of convolutions this summer, and even this last week with the federal elections, things are hectic across the country, that Anchorage, its citizenry, its police, everybody performed in a most admirable manner. We've had no conflicts similar to what we've seen across the land, and that's a credit to our leadership.
I appreciate that, Mr. Constant. I was thinking about that myself yesterday as well, and I agree with you. So any comments on that, Chief?
Well, first, thanks. And second, I agree. I think that, as usual, Alaskans behaved well, and APD has been putting a ton of effort into making sure that people have safe spaces to exercise their constitutional rights, but that those safe spaces don't turn into disaster zones. And I know that I've had lots of individual discussions with everyone off and on over the summer, but we put a lot of effort into maintaining sort of an invisible presence at a lot of these things and just making sure that they go off well. So, I really appreciate it. But honestly, it's been a huge team effort at APD, and there have been literally dozens of people involved. So it really, they did all the work, and the thanks goes to them.
Great. No, I appreciate that. And I agree. We need to thank the municipality of Anchorage. So, okay, then let's move on to Anchorage Fire Department. So Chief Hetrick, any just normal updates? We do have something later to talk about in terms of the core team, but happy to hear any kind of update from the Anchorage Fire Department.
Good morning, everyone. Jody Hetrick here. My updates are pretty strictly related to COVID. We have seen an increase in our COVID-related responses. We have also seen a small increase in the number of employees who have COVID symptoms and are testing positive. So we have strict controls in place to ensure that those people do not impact our patients and the other members of the department. So to remind everyone, because everyone's getting a little COVID fatigue with all of the restrictions that we put in place. So the last 3 days we conducted a safety stand down department-wide. Did a refresh of all of our information, talked about our protocols, and kind of reiterated to reduce exposure to COVID outside of the department helps keep our employees and our patients safe. So that safety stand down went very well, and we'll continue to re-inject and try to prevent some of the complacency that can occur after being in emergency posture for months. So we expect that to hopefully help us keep our numbers of employees down. Because we've been seeing an increase in the number of positives, that is driving our overtime costs, because if they can't come to work, we fill those positions. So we'll definitely expecting to see some of those numbers continue higher than they typically would this time of year. And good news, I can't remember if I'd shared last time, we made 25 conditional offers for firefighter, and those firefighters are working their way, or potential firefighters are working their way through the conditional offer process, which includes psychological exam, medical physical exam, background checks, things along those lines to ensure that they meet all of the requirements before they start. We expect our academy to start mid-January, and they would be graduating at the end of April so they can be fully staffed on the line. So those are the two updates I have today.
Okay, great. Thank you. I've got a question for you, but I want to mention for the record that we have been joined by Suzanne LaFrance. So Chief, one of my questions is, you mentioned that you have 25 qualified applicants heading toward the academy here pretty soon. And I think if I remember correctly, you had about 400 original applications. So is it typical to kind of go from that number down to a real qualified number of 25? Are we still kind of in the range, or are we still really short of a solid applicant pool in this community?
400 is about an average number of applicants, and not all of those applicants are qualified. That's why we have a selection process that weeds it down to, the number that we need to hire. The number that we select for final applicants is based on our vacancies, or expected vacancies, because this is an attrition academy, which is basically just backfilling people who are expecting to retire next year. So that's why the number is 25. But our applicant pool was better demographically than we have seen in the past, but we would like to see it even more diverse. Our percentages for minorities and women making application and then making it through the process are still much lower than we expect. So we definitely need to continue to work on that.
Great, I appreciate that. So any questions from the members for the Anchorage Fire Department? And I'm not seeing any, so we'll move on. And I'm not sure if we have anybody who's joined us here from the Department of Law. So I will just open that up for a minute to see if maybe Miss Stanley's with us or anyone else from the law department. And I'm not hearing anything. So we will move on from that one too. I don't believe we have any new business at this time unless there was something that somebody from the committee wanted to bring up that we should be looking into. Oh, I see that Miss Stanley is with us. So let me move back a little bit. So Sarah, go ahead. Miss Stanley, did you want to do an update for the legal department?
Ms. Chair, it looks like her audio is
Yep,
having.
it says her audio is failing. So, okay. All right. Well, we'll just, we'll come back to Sarah Stanley here when she gets everything logged on here. But let's move on for now, and we'll actually kind of stay with the Anchorage Fire Department then and talk a little bit more about the core teams from the Anchorage Fire Department. I think we've all had some interest lately in trying to figure out how to better coordinate what the core teams are actually already doing in the community, how they're functioning, and with this idea of mental health response teams. So I'm pretty sure we're going to have more of a conversation in that regard when we talk about the alcohol retail tax revenues here at our next meeting. But anyway, I know Chief Hetrick has a lot to say about how those services from the core team could actually expand to be more useful and to really better tie into this idea of mental health response. So Chief Hetrick, I'm going to turn it over to you and let you kind of give us this bigger, broader vision of what the core teams could really be doing. So.
Okay, good morning again, everyone. Our thought process over here in our proposal is really built around the core team meeting the mental health emergency response piece when it comes to our, expanding to meet the needs of the community. We are proposing to staff. We actually have two proposals. Our initial proposal was 12-hour staffing, but we also have a 24-hour staffing proposal, and that would be to have teams with a firefighter, paramedic, and a behavioral health, mental health clinician would be in a vehicle, and they would be the responders. When there was a call out, they would directly respond to the individuals who are in crisis and help deal with the situation at that time. Then back at the rest of the team would be fleshed out with a work unit manager, which would be a battalion chief position, and an admin person, because anytime that we're doing this type of work, there's a significant amount of documentation and administration that needs to happen. But we're also asking to bring on 2 social workers who will act as case managers to do the follow-up after the initial crisis piece and crisis intervention, to have the social workers become case managers to help ensure that the people that we are interacting with get inserted into some appropriate type of service or make the right connections. So case managers, that's really where they come into play. And that's our staffing proposal. We have office space, and there is a small non-labor budget assigned with that, because of course we need vehicles and the computers and things that go along with that. And it is basically our proposal that when mental health related calls would come into 311 or 911, they would transfer to AFD dispatch for triage. Hopefully, and we know that this will all take months to set up, eventually we'll get to the statewide crisis line, to where they would triage the call based on what the caller information is provided, and then they would transfer. Some would go to the call center, some will go to the mobile or the mental health crisis team for response, And then some may have a medical component where we would do our traditional response with an ambulance and a crew to medically stabilize a patient. So we expect that our fire dispatch already triages those types of incidents. So that's where that work would fit the best, that our dispatchers would be that triage piece. In order to do that, we would establish triaging criteria and work with subject matter experts so that basically it's a single resource that are routing calls appropriately. And I think our biggest gap will be waiting for a place for some of those who need mental health services or inpatient care, a 24-hour stabilization. How soon can those components come online? So starting with the core team, because we already have protocols in place, we already have a staffing model, we already have kind of an idea of what we're going to do. And we recently brought on a mental health clinician intern in cooperation with UAA. So today, actually for about 3 weeks, the core team is no longer a team of one person, one firefighter paramedic. Now we actually have a team with a mental health clinician and a firefighter paramedic, and they have, in a month, they have responded 30, I think the last time I checked, their first 3 weeks, I think they've been to about 32 patients. So I think that was definitely a viable option. We are still doing, our focus at this point is still high utilizers, but we are starting to pick up some others as well, and can kind of continue down that road of building the team. But until we have the full, full engagement of, yes, we are going down this road, we can't put all of the pieces in place until we're ready to do that. And that will take several months to working out all of the details of how all of this works together. But we think we're positioned the best to start that sooner than later.
Thank you, Chief. I've got a question for you, but I also have Ms. Zolotel has a question, and I'll let her go first. So Ms. Zolotel.
Thank you, Madam Chair. I just wanted to provide the context that on Friday, November 13th, we have an hour work session with our consultant. I know our consultant has worked closely with Chief Hetrick. That particular work session is to allow us to do a deep dive on costs, some of the cost modeling, and any outstanding questions. So I just wanted to flag that because I do know it's been a point of conversation for budgeting purposes. So we did want to be able to hear from our consultant prior to making those decisions. Thanks.
Thank you, Ms. Zolotel. Yeah, that's good information, so we can keep that in mind. And I was going to ask a question about cost anyway. So, Chief, I don't have the document in front of me, but I remember when you did the presentation on the alcohol tax that AFD might like to see in their budget. You did have specifically, really, the core team. Do you remember what that amount was that you were requesting to set up another core team with some of these expansions?
Assemblymember Kennedy, yeah, I'm not going to say I look at those numbers weekly, but we have tried a couple of different ways to trim down that price. So our original proposal was about 1.7 million, and that was for staffing, supervisor, an admin person, and that was 12-hour staffing. So basically, we're going to bring on 2 firefighter paramedics and 2 mental health providers and 2 case managers, social workers, or /social workers. So adding those, and we had also included a dispatch position. So we were at about 1.7 million. We have reduced that because we think that we probably, looking at our dispatch structure and how this will all work, especially for the first year until we really kind of see what our caseload's going to be, we think we're pretty confident we don't need the additional dispatcher for the coverage. So we have withdrawn that dispatch position and made a couple little modifications. So I think we're down to about 1.5 for 12-hour staffing. If our proposal is to immediately go to the 24-hour staffing, our original proposal was to have 8 teams made up of the actual responding team would be a case manager, mental health provider, and a firefighter paramedic. And since then, we've decided the case managers just need to be doing 40-hour work. So we would withdraw 2 of the case managers, and the 24-hour staffing, we would just add 2 additional mental health providers and 2 additional firefighter paramedics, which brings the total, I think we were down to 2.1. That's our most recent proposal. And we have been working with the consultant from the with the assembly, and that kind of helped us work through our process a little bit. And that's where we realized that, yeah, we probably didn't need the case manager piece. We didn't need 4 of those. 2 would be fine.
Great, thank you. Yeah, I'll look forward to that conversation, because I'm sure at that point we're going to really get into some more details. Have Mr. Weddleton in the queue. Go ahead, Mr. Weddleton.
Sorry about that, fumbling with the mute. So Ms. Hetrick, I appreciate leaning the cost on this, because as you know, it's been a concern of mine, but I still worry, we have, and the work that's being done with this is valuable, there's no question. But if this were taken on by the fire department and it's, $2 million doing great work, and then, your budget's always tight. I mean, every year, my time on the assembly, it's always tight. And there's proposals to cut here, consolidate there. And like the last round was cut a tender, okay? And I think we managed to somehow finesse it back in there. But you're going to continue to face that. And if you face an assembly and the public and say, look, we're going to cut a tender, they're going to look at this program and say, well, I don't think so. Cut that and do the tender. That's going to be a trade-off. So, I mean, what is it? I forget what it costs. What does it cost to have another tender or another ambulance on an annual basis?
Well, an ambulance is about $1.2 million. A tender is about $800,000 a year.
Okay.
I think we could effectively argue that it's a big difference cutting a tender, which we have 5 of, and especially in the winter months, than a service that we are utilizing all day, every day. It's kind of the difference that we see. We would never cut our EMS operation back, because that is the most needed service. So I think that would be a difficult argument to try to say to cut the core team or this mental health response, when I think data is going to show that this is one of our most vital programs.
Okay, good. Thank you.
All right, thank you. I have another question from Ms. Zolotel.
Thank you, Madam Chair. I just wanted to flag for kind of some advance notice on the work session. I had raised previously with the chief, and just want to raise it again, the question of whether or not you'd need to add any specialized clinical supervision to your team. I know you have medical supervision, so that'll be a question I'll want to revisit at the work session. You can certainly address it now if you have the answer, but I didn't want that to get lost as we're looking at the potential staffing. Thanks.
And Assemblymember Zolotel, yes, that is on our list to add, but we wouldn't be hiring an individual. We'd probably be contracting with a mental health supervisor, very similar to how we contract with Dr. Levy, who's our medical supervisor. So there will be some cost to that. We do not have the number yet.
Thank you.
All right, I have one more question from Mr. Peterson. Go ahead.
Thank you, Madam Chair. And I wanted to go back to sort of the beginning of, and you mentioned that you had Chief Hedrick, you mentioned that you had an increase in COVID-19 calls. And are these calls for transport to the hospital, or that, and you think that might be where some of the employees, caught the virus?
Member Peterson, actually, it looks like, because we're doing our own internal contact tracing through our health and safety office, that it appears most of our employees, actually so far, 100% of our employees probably were exposed to the virus outside of the department. just as in everyone, we try to keep our bubbles small, but most of our people have large families and lots of kids, and trying to control all the activities of all of our family members is difficult. So we are trying to reiterate with them to keep their to keep their home bubbles small so that they're not exposing their work bubble, the rest of the employees in their work bubble. But so far, we don't believe we have had any patient to employee or responder COVID spread.
Well, great. That's good news. Thank you.
Thanks, Mr. Peterson. Are there any other questions then for Chief Hetrick? And so I am not seeing any. So thank you, Chief. Obviously, we're going to be talking more about this in a couple of other groups and meetings that we're going to be having this discussion in. So thanks again for the info. We're going to move on then to the next thing on the old business agenda. That's the Public Safety Committee's community checklist, or what Mr. Perez-Verdia refers to as our to-do list. And I'm not sure if everybody's had a chance to actually look over that yet. I believe it's up on the web page for the committee. But I just wanted to see if there was any feedback on that at this point. We are trying to kind of, like Mr. Perez-Verdia says, keep this running checklist up to date so that the community has the opportunity to kind of see how we've been responding to some of the concerns and the questions and the ideas that the public brought forward. Oh gosh, it's been several months ago. So earlier this summer, I would say probably in the July and August timeframe. And for the most part, the list has several topics on it that have either they've either been answered, it's something that's been done, it's completed, or it's something that is ongoing, or it's something that we really have. Oh, thank you, Mandy. I see it's up on the screen now. Or it's something that we really haven't committed to any kind of an actual action on. So there are certainly some things that could be added to this list. So I want people to feel free to do that if there's something else that that we need to be looking at or addressing. But for the most part, we just want to be using this to see if there's something else we need to be doing, if there's something that isn't completed yet, or if we just need to decide that this is something that's really not part of what this committee should be doing. So we'll check here on the queue. It looks like, well, I'm not seeing anybody with any questions at this point, but I certainly do want to see if the members have any feedback. Oh, I'm not hearing many comments, any comments actually. So we'll go ahead and move on from this then. But I do want people to know that this is something that I would hope that you could either help decide what kind of things we need to really be addressing if we're actually done, or even if this kind of document is even useful. I'm hoping that it is to the public so that they get a sense of what we're doing. We recognize that not everyone can attend these committee meetings, and a lot of times it's difficult to get the information from the committee meetings that we've had, unless you're good at searching for the audio or the archives on this and spend the time looking into it. But we thought this would be kind of a relatively short and easy way to keep people updated. So again, comments are welcome. All right, I want to move back then to Miss Stanley and the law department update. So Miss Stanley, sorry about the audio issues. We all get them every once in a while, but please go ahead.
Yeah, I apologize. I mistakenly let my computer restart right before the meeting. So COVID is hitting our department pretty hard. And just the whole court system in general. There was a new order that just came out this week, delaying trials again till December. They were going to start in a couple of weeks, but now it looks like December, and I would be surprised if really any trials happen before January. Currently in my office, over half of our secretaries are out because they're either quarantining or or they tested positive, or they're taking care of children who are quarantined at home. And a little under half of my attorneys are working at home for similar reasons. Unfortunately, we don't have the technology to have all of the attorneys work at home. So we are covering our court hearings and we're getting our business done, but we're kind of thin, especially secretarially. So that affects things such as just case flow, discovery, things like that. But quarantines are temporary. People will only be out about 14 days and then they're back. So so we are covering the work we have to, but there is a backlog of cases in the court system right now, and when people are out, we get a little bit further behind, and then we work pretty hard to catch up, and then the COVID continues. So that's kind of where we are. I don't mean to sound too grim, but it is hard when people are out. So we are following all the protocols we can in our office. We're actually pretty proud how well we've been doing. We've been in the office since about June. But even with all the protocols in place, as was said earlier, people have families and they have other exposures besides our office. So we're just trying to keep our people safe. And that's what I have.
All right. Thank you, Ms. Stanley. Yeah, that does sound like a challenge. I do have a question for you. I don't see anybody else in the queue right now, but I have a question just in regard to dealing with some of that overload in cases. I know that you have the ability to contract out for defense attorneys when you have a caseload that where you need that. But I'm assuming that there's really nothing similar to that where you can contract out for any kind of overload. Is that true?
You mean to hire more prosecutors?
Yeah, just to hire somebody from another firm, just basically contracting for a temporary help?
No, there isn't such a system in place. The problem isn't that we have enough attorneys. The problem is that it's hard. They don't all have virtual access. So when someone has to quarantine at home, if we have a limited number of laptops, they may not be able to work as effectively and have access to our database. They can get some things done, but not their full caseload. So yeah, the issue isn't number of people as much as it is the ability for all those attorneys to actually access the information they need remotely.
Okay, well,
yeah.
If you don't mind if I interrupt, then that's kind of interesting, because it seems to me if it's just kind of an equipment issue with just computers, the technology, that I would think that would be an even easier fix. So
yes, and it's in the proposed budget, I believe, to get remote access for all the attorneys in my office, which will be really important, especially going forward. Right now, court is all telephonic, so attorneys can cover court from home if they have that access. But going forward, we don't know how long the courts will want everyone to continue to be, telephonic instead of using paper files. So yes, it is a relatively easy fix in that it's just technology that has to be funded, but that's where we are. Yeah.
Okay, great. Well, thank you. I have a question from you though, from Ms. Zolotel. Ms. Zolotel.
Yes.
Thank you. And it might be for Ms. Stanley or maybe for Mr. Falsey if he's listening, but to the extent that this need is COVID related, is there any request or opportunity for expedited procurement through the Emergency Operations Center, particularly if it's affecting kind of workflow? I just kind of want to know what the interplay between those two, the emergency operations and this direct impact on this department might be.
And honestly, I believe Kate Vogel has been interfacing with budget. I know I put in the request for the laptop piece as part of my request in the alcohol tax funding. I think it might have, I don't know, in my initial proposal, I don't know, Kate's been doing the budget request for the whole Department of Law. I think I think it's in the 2021 budget, but I would have to defer to Bill or to Kate for sure.
Yeah.
So I
no,
don't know if it's been, asked for through COVID funds.
And this is Bill Falsey. I'll follow up on this after the meeting. I know that in my departments, we have made some laptop purchases, both for human relations, and now we're moving into it with the police department to accommodate remote working. We are ways that we can do it sooner than waiting for January 1st. So I just don't know the status of this, and I'll take it offline.
Thanks so much.
Yeah, thank you, Mr. Falsey. That was what I was hoping to hear too, because my thoughts were going that way too. Seems like we ought to be able to do something a little more quickly. So appreciate the help there. So any other questions from members for Ms. Stanley? And I don't see any. So thank you, Ms. Stanley. And we'll just move on then. I just kind of want to open this up at this point. We're pretty much done with the agenda. But I see if there was anything else that the members specifically wanted to bring up or add to the discussion here, because it looks like we may wrap this up pretty quick here. So I'm not seeing anybody in the queue. No one's jumping in, and I want to do the same for staff. If there's anybody from the administration that wanted to add into any of this conversation, please, it's open to you all as well.
Madam Chair, if I may, this is Meg Zalatul. Yeah, as we work on and move forward with mental health first responders, I would like to propose to the chairs of this committee, co-chairs, to hopefully keep that work here in the Public Safety Committee. I think it is a key piece to public safety. It does have health implications, of course, with mental health, but I think it is part of our public safety response. So just wanted to toss that out there, that I hope to continue to see that conversation and work happen through this committee. Thanks.
Great. Thank you, Ms. Zalatul. I appreciate that. And I think that helps a little bit to clarify kind of who wants to not necessarily take ownership, but I know it's easy for things to get kind of dropped in between the handoff from one committee to the other. So thank you, and I'll take that up with our co-chair. I'm sure that's something we are more than happy to do anyway. So I think I have Miss Allard in the queue. So Miss Allard, go ahead.
You do. Thank you, Mrs. Kennedy. So the reason I guess I have a question, and I don't need no names, obviously, but for the first responders and APD, Chief and Chief Hedrick, can you guys tell me, Chief Dahl, could you guys tell me an estimated number of individuals within the fire department, in the municipality, and within the APD who have had positive testing on COVID? Just like, and you might not have the exact number. Can I get that? I don't know if you have it offhand.
Assembly Member Allard, I believe we're at 21. And obviously we can't share who those people are, but out of the response line, I think we're between 18 and 21 right now.
Is that okay? Thank you, Chief. I
And
appreciate it. And that's out of how many people?
329.
Chief Dahl.
Hi, this is Justin. I want to say that we've had about 15 positive tests inside of APD. Oh, sorry, I just got updated. It's actually 12. And that's out of 600. Well, let me see. That's out of about 598 employees that we currently have working at APD. We've had to do lots of isolation and other things, as precautions like other agencies have. But we actually just discussed it at a senior command meeting this morning and feel like, given the amount of exposure that our folks have being out in the community every day and responding to calls for service where we know folks are COVID positive, we feel like that's a pretty good number out of our total employees.
Especially for what you guys are doing, because all of you guys are our first line responders. So thank you very much. I appreciate it.
All right, thank you, Ms. Allard. Anyone else from the committee or any other comments from staff or the administration as a whole? So. Well, I don't hear any, don't see anybody in the queue, so I want to open it up to audience participation. And, I realize that this makes it a little bit difficult in this kind of formatting, but bear with me here. If anybody does want to participate from the audience, from the public, please unmute yourself, *6 on your phone. If you're not on the Teams, well, obviously you're going to be on the phone. So anyway, do we have anyone that would like to comment? And the extended silence tells me there is no one else that wants to comment. So with that, we will adjourn this meeting and see you all at the next one next month. So, all right, thank you, everybody. This meeting is adjourned.